So today we'll start off with beta-lactam antibiotics. We'll try to take two classes and try to finish it. थोड़े missed classes भी है वो भी खत्म हो जाते हैं. We'll try to finish off one topic in antibiotics. So we've started the next chapter, that is antibiotics. In that, the first type of antibiotic that will be beta-lactams. Now there are several classes of antibiotics for you guys. एक के बाद एक we'll try to finish there, about 15-20 classes I think overall. Right. पूरे बीटा लैक्टम एंटीबायोटिक्स का जो है बीटा लैक्टम एंटीबायोटिक्स okay, the name itself comes because these antibiotics will have a particular ring in their structure. Okay, that's not a ring. They will have a ring in their structure. That ring is called a beta lactamase ring or beta lactam ring. Sorry, वो ring के presence की वजह से वो antibiotics को beta lactam antibiotics बोलते हैं. Okay. As such, there are 4 different classes of beta lactam drugs. Okay. So this is a major class. Under that, you'll have subclasses. Okay, or you can call them classes as well. We have penicillins, cephalosporins. Now, from here on out will be the main memorization part of pharmacology. My part where I properly explain things to you will be very minimal. It will be only restricted to mechanism of action and maybe a few special scenarios of that drug. Other than that, most of it will be memorization. So you'll have to start reading quite a bit. Monobactams and carbapenems. Okay, these are the 4 main classes under beta lactams. ये पूरों के अंदर बीटा लैक्टम रिंग रहती, ठीक है. Now all of them will work by the same mechanism of action, which is advantageous for you. So whenever you have to write MOA, mechanism of action for any of them, all of them will have the same mechanism of action. ठीक है. एक एंटीबायोटिक्स के बारे में आप जब लिख रहे हैं, any antibiotic, not just beta lactam antibiotics, whenever you write about antibiotics, see generally in your question paper how they will ask is they can ask in 2-3 different ways. One way they'll ask is simply explain X and X. ठीक है. Explain beta lactam antibiotics, explain sulfonamides, explain penicillins, explain anti-TB drugs. ऐसा पूछ सकते हैं. In that scenario, if they are just giving you broadly explain this, the whole thing, then what you need to write about that particular class of drugs will be, first of all, the classification. Okay, what are the classes, subclasses under that, and each class and each subclass में at least 1 to 2 examples of a drug. Okay, so I'll show it to you in a bit what will be the drugs that will come under penicillin. So today we'll start off with penicillin. So hopefully we'll try to finish the other 3 as well. But essentially, I'll show you how classification is written. Okay, there are several ways of writing classifications as well. एक कोई तरीका भी, if you stick to any one of them is also fine. Okay, as long as you keep it consistent. Okay? If you're classifying it based on source or based on activity, कैसा classify कर रहे हैं, आप उसको criteria पहले दे देना पड़ता. So classification based on source ये natural है, synthetic है, semi-synthetic है, वैसा दे रहे हैं आप. Versus let's suppose classification based on activity. So based on activity on maybe aerobes, anaerobes, gram positive, gram negative, आप वैसे categorize करें. अलग-अलग तरीके हैं categorize करने. That will come under classification. Then you'll write spectrum, antibiotic spectrum. So the spectrum of any antibiotic drug as such will be its coverage. What all bacteria will it be able to counter? What all bacteria will it be able to kill or it will be able to inhibit? Okay. Spectrum is very important whenever they are asking explain. Now, as such, sometimes they can specifically ask, write the spectrum of this class of drugs. Okay? So you'll have to write the organisms that those antibiotics cover. Or else if the question asks only explain this and this, you'll have to include a spectrum. अगर नहीं पूछे तो जरूरत नहीं है लिखने की. If they are being vague, then you'll have to. Okay, if they are generalizing it, then you'll have to. Spectrum लिख दिए. Then you write mechanism of action. How does that drug work? Okay. Then you write. अब mechanism of action, see, एक classification में, let's suppose beta lactams है, उसमें एक classification में एक बार mechanism of action लिख दिए चल जाता. Because all of those drugs follow the same mechanism of action. They'll work by the same method. That is fine. But you will come across more often than not, what will happen is in a single classification, you'll have several subclasses, and each of those subclasses will have a different mechanism of action. In that respect, you'll have to write the mechanism of action of each and every one of them. Okay, you can make it simpler by actually at your nursing level you don't have detailed mechanism of actions. Just a 4-5 step this thing flowchart bana diya ho jata mechanism of action. You just write 2-3 sentences below it and it will be done. You don't need to go into a lot of detail with respect to mechanism of action, but you need to make sure it is correct. Okay, that then mechanism of action के बाद now it will be drug specific. Let's suppose एक drug के बारे में लिख रहा है, तो generally speaking एक class में, so let's suppose I take penicillins, ठीक है, penicillins के अंदर 4-5 different classes है, सब classes, ठीक है. अब पूरा का mechanism of action same है, तो you don't need to repeat it, but you will come across drug classes where each of them will have a different mechanism of action. So आपको 5 अलग mechanism of actions लिखना पड़ता है जब. Okay, if it has a different mechanism of action, you'll have to write it differently. Then in each subclass at least mention one drug. ठीक है, तो यहाँ पर X mention करे, आप Y mention करे, Z mention करे, यहाँ पर P mention करे, यहाँ पर Q mention करे, let's suppose. Now, why is it important that you are mentioning one drug from each class? Because you'll at least have to describe one drug from that class in detail. In detail का मतलब अब कैसा रहता है, ये ड्रग के बारे में you have to write those mechanism of action तो आप कैसे भी class specific लिख दिए, those what do you call the conditions in which the indications of the drug, meaning where those drugs can be used, the ADRs of the drug, ADRs and side effects of the drug, the contraindication of those drugs, where it should not be used. Okay, those 4 will generally be included, and PK/PD parameters. Okay, simple PK/PD parameters. What is T half? What is the route of elimination? What is the source of absorption? What is source of this thing metabolism? Generally metabolism, absorption नहीं लिख के भी तो चलता. Sometimes in special places you'll have to mention, but more often than not, only T half and metabolism is mentioned. T half specifically along with elimination, the route of elimination. कैसा eliminate हो रहा? Either it is renal. Most drugs will be eliminated through your kidneys, that is through your urine. Some drugs will get eliminated through other routes as well. So you'll have to mention it like that. So these are the things that you'll have to mention when writing about any drug or any drug class. Okay. Now in this, the whole jargon that I just explained to you, from classification up to dose and everything, the only part of understanding, okay, in which I can help you, or as such where you need someone else's help, will be mechanism of action. Just understanding how the drug works. Okay, what that drug does inside your body, the PD part, and maybe a little bit of how elimination of that drug works if it's a special drug. But other than that, most of it is pure memorization. Okay, most of pharmacology is pure memorization. So that is why it is very, very important that you start off early and you try to get a hang of it. Try to memorize as soon as possible. जैसे जैसे chapters होते जा रहे, don't let it sit for till your exams come, because it will get very, very difficult. Now at this moment you're only seeing 4 classes. ठीक है, अब जैसा एक main class में 4 classes है, you will come across major drug classes which have 10 subclasses, and those 10 subclasses might have subclasses under them. So it can get complicated. That is why आज का खाना आज खाओ, खत्म कर दो. Okay, don't let it sit for a long time. Especially what happens is, for a subject like pharmacology, if you let it sit, in the end, even if you try to memorize it, until unless you're a freak, what will happen is, and you're blessed with amazing memory, what will happen is you'll start confusing classes in between. So एक की क्लास एक में लिख देते, एक की क्लास एक में लिख देते, नहीं तो एक ही सब क्लास एक में लिख देते, एक का ड्रग इधर का इधर लिख देते. That will make major mistakes. ठीक है, so I strongly suggest that you start practicing from day one itself. Okay? Don't let it sit. Now that it is done, we'll start off with mechanism of action of beta lactams. So show you a flowchart. ऐसा लिख दे सकते हैं आप. It will become easier for you to memorize as well, and it will be easier for you to write in your exam as well. So this is the mechanism of action of beta lactam antibiotics. All beta lactam antibiotics will follow this particular type of mechanism of action. Beta lactam antibiotics, what they do is, once they go inside the body, this action is happening on the bacteria. Okay, these drugs are bactericidal. So any antibiotic as such can be categorized into 2 ways. Okay, it can either be bactericidal or it can be bacteriostatic. Bactericidal का मतलब है it will simply kill the bacteria. Okay, as such it will destroy the bacteria. The bacteria will die as a result. Bacteriostatic का मतलब ये रहता कि that bacteria will not be able to divide. There is a big difference. In the second part, whenever you have a bacteriostatic drug, it is only inhibiting the growth of the bacteria so that your body can cope up and your immunity can handle the bacteria. It is only giving your body a chance so that it can fight. Bactericidal drugs will outright kill the bacteria. Bacteriostatic drugs will only stop the growth. They will not kill the bacteria. And that stoppage of division of that bacteria will only last till the drug is inside your body. So let's suppose you give some A drug or some X drug, and that is a bacteriostatic drug. Let's suppose the duration of action of the drug is 8 hours. It means that for the duration of 8 hours, bacteria inside your body will not divide. Okay, that specific bacteria on which the antibiotic drug is acting. Okay, not every bacteria. So for 8 hours, it is not dividing and it is giving your body a chance to fight back. After 8 hours, if you're not giving another dose, that bacteria will start to divide again. It will start to recuperate again. Okay, and you'll start seeing the symptoms of the infection again. So that is one major difference that you need to remember: bactericidal and bacteriostatic antibiotics. Now, penicillin specifically or beta lactams as such are bactericidal drugs. Okay, beta lactams क्या करते हैं? Once they are going inside their body, they will act on this PVP layer, penicillin binding protein बोल के एक रहता. This is present on the cell wall of your bacteria. ठीक है? These penicillins और यहाँ पर PVP बोल के लिखते हैं. The receptor is called PVP. Okay, beta lactam antibiotics, all beta lactam antibiotics will go and attach to that receptor, and they will inhibit cross-linking of peptidoglycan. Why is cross-linking important? Without cross-linking, the cell wall of that bacteria will become very, very deficient and very weak. Okay, so once again, I'll repeat. Once your beta-lactam antibiotic enters your body, let's suppose you go to a hospital and you are diagnosed with one infection, which the doctor is treating using beta-lactam antibiotics. Any beta-lactam antibiotic, let's suppose cephalosporin diya या penicillin diya. That drug, once it enters inside your body, it will reach, it will get absorbed, it will get liberated, it will get distributed, and it will start going into specific areas, specific tissues where that bacteria is, and it will start binding to certain proteins and certain receptors on the surface, on the cell wall of that bacteria. Whenever this drug starts to attach to the receptor, it will inhibit peptidoglycan cross-linking. Peptidoglycan is an important component of the cell wall. Okay? Specifically, inhibition of transpeptidases करता है. Transpeptidase बोल के एक एंजाइम रहता है जिसकी वजह से क्रॉस लिंकिंग नहीं होती. Okay, because of inhibition of transpeptidases, peptidoglycan cross linking is not occurring. As peptidoglycan cross linking does not occur, the cell wall of that bacteria will start losing its integrity. It will not be as strong. Okay, it will start to become more and more weak, and it will start becoming deficient. As such, what will happen is that cell wall will eventually break. As the cell wall is breaking, now essentially what is happening is you're literally tearing the bacteria apart. You are lysing the bacteria, because of which the bacteria dies. That is the mechanism of action of beta-lactam antibiotics. Simple as it is. Very, very simple. Antibiotic अंदर जाता, bacteria के एक receptor पर attach होता. It will यहाँ पर it is not mentioned that it inhibits transpeptidases. It directly went on to cross-linking, inhibition of cross-linking peptidoglycan. But essentially what happens is once this penicillin goes and binds to penicillin binding protein, that is PVP, it will inhibit transpeptidases. As transpeptidases are inhibited, cross-linking of peptidoglycan does not occur, because of which cell wall becomes weak. And eventually what will happen is the whole cell wall lyses and the bacteria dies. Okay? That is the mechanism of action. Now, you may think that it will affect humans as well, because it is affecting peptidoglycan. Humans also have peptidoglycans in their cell membrane. It can affect humans, no? But the thing is that peptidoglycan layer is unique to the bacteria. The amount that is present in humans is almost negligible, and it is not present in cell membranes and our cellular structures as much as bacteria. So penicillin is practically non-toxic to our cells. Even if you give a large dose of penicillin, you will see other effects rather than our cells getting damaged. Okay, so there'll be no problem in our own cells, but it will be, it will have a bactericidal effect on the bacteria itself. I hope you understood this. If you did not understand the mechanism of action, please feel free to ask.
Sir, can you repeat it once more?
Okay, which particular part did you understand, Akansha?
So that inhibit cross linkage of peptidoglycan.
ओके तो क्या होता, पेप्टिडोग्लाइकन बोल के एक इम्पॉर्टेंट कंपोनेंट है सेल वॉल का. इमेजिन, अच्छा, हैव यू एवर प्लेड विथ दिस थिंग, क्या बोलते हैं लोग, ब्लॉक्स, आई फॉरगॉट द नेम ऑफ दोस ब्लॉक्स. छोटे बच्चे खेलते देखो, आई फॉरगॉट द नेम ऑफ दैट
Mm,
टॉय ऑल टुगेदर. You get small blocks like this, right? And you can build small houses and small structures with that. uh, I forgot the name of it. I don't remember. But essentially, you get, if you step on it, it'll be very helpful as a adult. But essentially, children use it. You use it as a building exercise and a neurological exercise for children as well. You'll be able to build structures with those blocks. Small blocks are there. Cars build kar sakte. You can build several things. Legos बोलते हैं लोग. हाँ. So those Legos are essentially, think of Legos as peptidoglycan layers. Okay? They are single components that are important, wherein these are attaching to each other and making sure that the cell wall of that bacteria, imagine these blocks are peptidoglycan, they are attaching to each other and making sure that the cell wall is nice and it has integrity, it is strong, essentially. अब यहां पर क्या हो रहा, see, any cell, any living organism, अब जैसा अपने पास एपिथेलियम इट रीजनरेट्स, द सेम थिंग हैपेंस टू द सेल वॉल ऑफ द बैक्टीरिया. ठीक है, older cells die, your cells are replacing the older cells. At this point, what will happen is your penicillin fellow, so let's suppose this is penicillin, this fellow is coming and attaching to a what particular receptor called PBP. ठीक है, receptors of protein, तो उसको penicillin binding protein बोलते हैं. Once this penicillin is coming and binding to this particular receptor, what happens is, imagine that these structures, peptidoglycans, are getting attached to each other using a type of cement. Okay, and that cement is transpeptidase, the enzyme transpeptidase. Because of the presence of transpeptidase, these peptidoglycans can attach to each other and make sure the cell wall is strong. अब आप क्या कर रहे हो, उसमें से सीमेंट निकाल दे रहे हो. So essentially, you are inhibiting one particular enzyme that is responsible for making sure peptidoglycans are attaching to each other. Okay, because that enzyme is being inhibited in the presence of penicillin. Once penicillin goes inside, it will inhibit or it will attach to that protein. And once that protein is activated by the drug penicillin, what will happen is the enzyme transpeptidase, which is responsible for peptidoglycan attachment, will not be present. It will be inhibited. The transpeptidase inhibition leads to what you call inhibition of cross-linking between your peptidoglycan. Essentially, what will happen is यहाँ पर chinks बनने लगते हैं. Essentially, imagine this is the peptidoglycan, and यहाँ पर literally gaps आने लगते हैं in the cell wall. Eventually, what will happen is, because of this weakening of cell wall, that bacteria will literally tear apart and it will die. That is how penicillins work. It will lyse the bacteria by decreasing the integrity of the cell wall. ठीक है, सेल वॉल को जो एक एंजाइम होना, for which peptidoglycan, through which peptidoglycan can attach together, penicillins are essentially inhibiting the release and inhibiting the work of that particular enzyme, because of which peptidoglycans can't attach together, and cell wall is becoming loose. Because that cell wall becomes loose, it will tear apart. The whole cell itself will tear apart. It will not be able to bear the brunt of your bodily fluids. अभी समझ में आया?
Yes, sir.
Okay. Anyone else? Any doubts in the mechanism of action? Okay. So now we'll go to the classification of this thing. So this is one way of classifying this thing. क्या बोलते हैं? 5 ways of, sorry, 5 ways of classifying your penicillins. अब अपन penicillins का ही बोल रहे थे. As I told you, there are several ways of classifying penicillin. अब अगर sources आप क्लासिफाई करें तो नेचुरल सेमी सिंथेटिक आता है, एक और सिंथेटिक बोल के भी आता है, इट इज नॉट मेंशन्ड हियर. या अगर आप रूट ऑफ एडमिनिस्ट्रेशन से क्लासिफाई करें तो ओरल एंड पेरेंटल. You don't have to write all of them. Okay, in your exam you can choose to write any one of them. You don't need to write all of them. आपके textbook में one of those methods will be mentioned. More often than not in your textbook it will be mentioned is the spectrum of activity. Narrow spectrum है, broad spectrum है, intermediate है या extended spectrum है. या फिर they will mention it based on source. ये दो पॉपुलर मेथड्स है करने के. ठीक है, आप कौन सी टेक्स्ट बुक यूज कर रहे हैं, बेस्ड ऑन दैट इट विल चेंज स्लाइटली, बट जनरली दे विल ओनली यूज वन और द अदर. या तो सोर्स यूज करते हैं या फिर स्पेक्ट्रम ऑफ एक्टिविटी से यूज करते हैं, क्या स्पेक्ट्रम कवर करता है. Now, as such, one of the first antibiotics that came in penicillins was the parent drug as such was penicillin G. But the problem with penicillin G was it could only be given IV and it had a very narrow spectrum. It could not be treated as a broad spectrum drug. You cannot give it for several infections. So उसकी वजह से क्या हुआ? Semi-synthetic versions started to be made. Especially you have acid-resistant version, you have penicillinase-resistant version, you have aminopenicillins, carboxypenicillins, uridopenicillins. You have another supportive class of drug called beta-lactam inhibitors, beta-lactamase inhibitors. ये पूरे बाद में है. Initially penicillin G था, ठीक है. Penicillin G थोड़े दिन काम करा, उसके बाद see, you have to remember that antibiotics also, your bacteria will start getting used to antibiotics. They will undergo mutations and they will become essentially resistant to antibiotics. So that started happening. As such, penicillin G was narrow spectrum. उस पे अगर resistance आने लगा हुआ तो the antibiotic has become completely useless or almost useless. So it can only be used for a very small number of bacteria, small population of bacteria. तो आप क्या करें? They started making semi-synthetic versions. ठीक है, extended spectrum बोल के बनाने लगे. Extended spectrum is broader than broad spectrum. It will cover a wide number of antibiotics, bacteria, gram positive, gram negative, aerobic, anaerobic also to a certain extent. Those extended spectrum are essentially aminopenicillins, carboxypenicillins, and uridopenicillins. जो आप देखते ampicillin, amoxicillin, mezlocillin, piperacillin, ticarcillin, carbenicillin, ये पूरे एक्सटेंडेड स्पेक्ट्रम है. इन लोगों का स्पेक्ट्रम बहुत बड़ा रहता है, ठीक है. ये बाद में डेवलप हुए सर. Now, essentially, if we talk about any penicillin as such, the main side effects that you see, there are a few side effects that will be common to a class as such, meaning all the drugs in that class will show similar and adverse effects. It is not that all those adverse effects will occur in the same patient, but most patients on those drug classes will show that adverse effects or side effects. Okay? Then you will have drug specific adverse effects as well based on the individualistic TKPD parameters of that drug. थोड़े अलग, you can have side effects. Now, if we talk about common ADRs of this thing, penicillin, you have local irritation. Now, penicillin allergy is a problem. Now, even though it is not as common as people think, it is fairly common. Now, you will see several cases with penicillin allergy, but they have not been properly tested. Even though they are showing a little bump, it is not necessary that it is always penicillin resistant. It is better to do a genotype study and try to find out, because what happens is we are essentially eliminating a whole class of drugs just because we think that the patient is penicillin resistant. So, there are ways to counter that, but essentially local irritation is a problem that can occur with penicillins. Then it can cause pain at injection site, especially penicillin G. Okay. Nausea, giddiness, essentially nausea, especially on oral ingestion. Okay. Oral ingestion of penicillins can cause nausea. It can cause thrombophlebitis. Now, thrombophlebitis is essentially what will happen is when you are locally injecting a penicillin, the blood vessel where you are injecting will undergo inflammation. It will swell, literally. That area will become slightly reddish and it will undergo a little bit of swelling. This does not happen with all penicillins, but with most penicillins it does. Okay? So thrombophlebitis avoid करने का बहुत सारे drugs से thrombophlebitis होता. One way of avoiding thrombophlebitis altogether is that you can inject it slowly. I'm not telling you have to make it an infusion, but IV भी दे रहे तो instead of giving it within like 5-10 seconds, give it over a period of 30 seconds or 1 minute. Slowly though. In certain conditions, penicillins, especially in case of toxicity, if अगर बहुत ज़्यादा dose दे दिए, it can cause brain toxicity. It can cause muscle twitching. It can cause mental confusion. Sometimes it can cause convulsions and coma, especially if you are giving very large doses. Now, penicillins as such, जो doses रहते penicillins के, especially जो IV देते, they are measured in million units. ठीक है? So you get 1.2 million units, 600,000 units. या essentially 500,000 units या 1 million unit, especially penicillin G and penicillin B जो है उन लोगों को million units में count करते हैं. You also have oral drugs which are counted in NG and all, but more often than not you will see this. If you are increasing the dose over 20 million units, that is when severe toxicity occurs, especially when it is injected quickly. What will happen is the patient might have coma, they will they will fall into coma, and they might have convulsions. Okay. Especially in case of renal insufficiency, if the patient is having renal insufficiency and their body is not able to eliminate the drug in time, वो condition में drugs start getting accumulated inside the person's body, and that large dose will eventually cause convulsions or coma. Some people will have hypersensitivity to it. Yes, some people will have hypersensitivity and irritation to penicillin as such. You will have around 1 to 10% of population is hypersensitive to this thing. And because it is a broad spectrum drug, what will happen is it can cause super infections. Penicillins, I told you earlier about super infections, what they are and how they can be caused because of improper use of antibiotics. Penicillins, if used improperly, they can cause super infections. Nowadays, penicillins as such utna use nahi kar rahe. Kare bhi to, the problem is that most people have become resistant, or most organisms have become resistant to penicillins. So even the more latest ones, they are also, even if they work, you have to use very high dose, and the trade-off is not really that good, in the sense that the benefit to loss ratio or risk ratio is not really that good. That is why other antibiotics are also preferred. In your textbook, you will find several different drugs. How it will be mentioned is that, let's suppose penicillin B के बारे में mention कर रहे हैं, they'll mention the dose. अगर आप prophylaxis के लिए use कर रहे हैं तो 250 mg, 500 mg, you give it 4 times a day, 2 to 4 times a day, oral अगर दे रहे हैं, and they will mention the indication beside that. For example, penicillin B is used for streptococcus, especially strep throat, या फिर scarlet fever के लिए use कर रहे हैं आप. Generally, younger individuals may use करते हैं penicillin B, like 5 to 15-year-old. You can use it for inflammatory disease. या फिर let's suppose अगर आप ampicillin use कर रहे हैं, ampicillin is also pretty common. You can use it for diarrhea. It can cause diarrhea. It can cause skin rashes. You have to avoid food when you are giving ampicillin. You'll see certain specific things about penicillins or about drugs as such. I don't need to mention all of them, but some of the important ones at least. For example, अगर आप ampicillin दे रहे तो आप ampicillin को sulbactam के साथ दे रहे. So there is one class of drug. Now, what happened is penicillins देते over the years, bacteria started developing one particular enzyme called penicillinase, and they started developing beta lactamase. These are the enzymes that are produced by certain bacteria on whom, if let's suppose there is one particular organism that is secreting penicillinase or it is secreting beta lactamase, उनके अंदर conventional penicillins काम नहीं करते, because essentially what they will do is, अगर penicillinase secrete कर रहा हुआ bacteria, it means that it can destroy the penicillin structure itself. Okay, that is why that enzyme is called penicillinase. Or if it is secreting one enzyme called beta lactamase, it can destroy the beta lactam ring. अगर आप ड्रग का स्ट्रक्चर, केमिकल स्ट्रक्चर डिस्ट्रॉय कर दिया, उसका फंक्शन चले जाता. Okay. So later on, what happened is, because scientists started finding these bacteria which were getting adept at coping up with penicillin, especially by secreting penicillinase and beta lactamase, there were special classes of drugs that were created just to counter these enzymes. For example, we have a penicillinase resistant penicillin. So आपके penicillinase resistant penicillin जो है, you will have the acronym PUND. ठीक है, तो essentially इसमें 5 drugs आते हैं. 1 second, I'll start another this thing meeting. I'm ending this one now. I'll start the other one. Join that one. I'll send that in your group. ठीक है. I haven't taken attendance. Join, all of you join the next one.